Let's take a look at the situation in Maharashtra and indeed across India, because the numbers at this stage are a huge concern. So let's bring up these graphics, give you an idea of the Maharashtra situation at the moment. As you can see, the spike at the end of that graph pointing upwards is huge. It's larger than it's ever been. And you have the active number of cases, those recovered, and the number of deaths. Now, those are the overall number of deaths which have taken place since the beginning of this crisis. But if you just look at the number of cases in a city like Mumbai in 24 hours, at 6,923 cases in Mumbai alone in 24 hours, it's a huge worry. And if you look at the India numbers, again, a week ago, or let's look at the bottoms number. 4 weeks ago, India was at 16,752 cases, growing at 0.2%. And a week ago, that went up to 43,846 cases. And today, on the 28th of March, 62,714 cases. So again, yet another indicator. And perhaps the biggest worry when you talk about trying to defeat the virus is the positivity rate. 4 weeks back, the positivity rate was 2%. The overall average since April 23rd last year was at 5%, and today it's back at 5%. A week back it was 3.5%, 2 weeks back 2.8%. So again, the positivity rate growing up sharply. That's another cause of massive concern. But let's go across to NDTV's Saurav Gupta, who's been tracking the situation in Maharashtra. Sort of 8 p.m. today were when there were instructions which were absolutely clear. People had to leave restaurants, malls. Has there been an acceptance of what the government's rules are?
Well, yes, I mean, if you look at the mall behind me, which is the Atria Mall in Worli, there definitely has been acceptance. In fact, the mall has been closed, people have left, restaurants are shut, and most people have gone home. That's what it is at this point, and the Chief Minister is already talking about lockdown-like restrictions, and that's because the cases are still continuing to rise, with a record rise even today. Over 6,000 cases in Mumbai. So obviously this is something that is going to be a worry for the administration in Maharashtra. The situation is not great here, and that's something that the administration is keeping a close eye on. In fact, they are, in the meeting that was held between the Health Minister, the Chief Minister and other top authorities of the state, what seems to have been decided is that the administration has been told to prepare for lockdown-like restrictions. What does that mean? Sources are telling us that transport is one thing that they're not going to touch. They're going to keep transport functioning, but shops, offices is something that they're going to ask people to keep shut for a while, perhaps, if at all those restrictions come into force. Now, this is something that perhaps will be decided after the 2nd of April. The government will meet, and that is something that will be clear then. But obviously the situation is grim, it's worrying, the number of cases that have been going up, and while health experts have blamed it on a double mutant COVID strain, the fact really is that whatever the strain may be, the numbers are definitely something that are really worrying. And what the administration fears is that it could put an added burden on the healthcare system,
right,
which has recovered from the first wave, and that's why they're preparing, right, so that that situation doesn't arise.
All right, Saurav, thanks very much for joining us with those details. Well, we're going to look at the situation in Maharashtra. Is a lockdown, is that something that may actually take place? Because the Chief Minister really did read the Riot Act, where he said today that people are not following the norms, and that this was something that couldn't be ruled out. Joining us now, Dr. Shashank Joshi, member of the COVID Task Force Maharashtra, Dr. Mufassal Lagdawala, the advisor of the Mumbai municipality and the jumbo facilities to deal with COVID. We're also joined by Dr. Hemant Deshmukh, the Dean of KEMH, and Dr. Sunila Garg, member of the Lancet Commission COVID India Task Force. Let me come to you first, Dr. Lagdawala. Do you believe that, given the numbers, that a lockdown across Maharashtra is imminent?
I think we've left little choice. I think the irresponsible behavior of people who've taken COVID for granted, and they've almost lost any kind of...
Sorry, we've lost that line with him. We'll get him back in a moment. Let me take that question across to Dr. Shashank Joshi. Sir, do you believe that a lockdown is imminent? Dr. Joshi, can you hear me?
Yeah.
Yeah. So, Dr. Joshi, yeah, I just asking you, do you believe that a lockdown is imminent?
So I think we can still avoid a lockdown if people behave responsibly and we are able to have adequate infrastructure. Currently, the Chief Minister is at its wit's end for two reasons. Number one, our healthcare facilities are fast filling up. There are no beds in private sector. Public sector beds are still available. The demographics of the pandemic is more in the middle class and neo-rich class, which is not willing to go to public hospitals. And even the public hospitals have started filling up. So the lockdown is only a strategy when the healthcare infrastructure is packed. I don't think it is the answer and solution at all. We still believe in micro-containment, improving testing, tracing, tracking as the solutions from a public health standpoint. And however, if there is a total, lack of cooperation from citizens at large, then probably these steps will be there. The current challenge, why the Chief Minister has said the administration to get ready in 2 weeks, is because we are growing at 10%. Every day, though we have ramped up our testing tremendously, we are adding numbers. Our test positivity rate has started climbing. Even in a city like Mumbai, where we have seen an exponential rise, our TPR, which was 18%, has come down to 12% yesterday. Today it is 14%. So it again gone up. If we see these large numbers, the only silver lining is very good recovery of 80 to 90%. It's a fast transmitting strain and also a very low death rate. It's all in single digits. But if the total sheer numbers keep adding and overwhelm our healthcare infrastructure, then obviously there is no choice but to have a lockdown.
So very briefly, Dr. Joshi, before I go across to my other panelists, since we've spoken last, is there any clarity on what type of mutant, if at all, is responsible for the large number of cases in, let us say, Mumbai at the moment?
So probably there are two strains which have been pointed out, and there is now a very active collaboration between the CSIR labs and Maharashtra government, and they are likely to do some district-wide zones. Two strains, both the strains are fast spreading. One is a 384 strain and other one is an L strain. And both these strains are probably a double mutant. I think they have gone on record. Even NCDC is aware of those 2000.
These are double mutant Indian strains, right?
Yeah, probably homegrown mutant strains. That's right.
And
they are faster transmitting and faster healing.
Okay.
And with low mortality.
Dr. Garg, to the best of your knowledge, do any of the vaccines we have work as effectively against the double mutant strains?
Yeah, thank you, Vishnu, for asking this question. Right now, both the vaccines are effective, but the time will come sooner. If we are, lax in our vaccination program, then these vaccines may not work. So it is important that we vaccinate as much as possible, along with COVID-appropriate behavior, physical distancing, and also we have to protect our elderlies because the festival season is on. So we need to take care of that. We not only follow our COVID-appropriate behavior, we need to keep track of our, micro-containment zone, testing, tracking, and, isolation. That is an important part. But we also need to take care, especially of elderly, and go for vaccination very fast. As of now, the vaccine is effective.
Dr. Deshmukh, how do we know that the vaccine is effective? Isn't it very early days? Because we've just recently started talking about, this double mutant and things like. How do we know the vaccine works?
We really don't know, Vishnu, whether this vaccine is going to work, but this is going to create a lot of pool of antibodies within the body itself, and these antibodies are good enough to fight any kind of onslaught from this COVID-19 virus. And so we still believe that any kind of vaccination that is going to happen in India is going to take care of the pandemic.
Dr. Joshi, just give us an idea of, what the government now at the center is doing is, they have said that, you don't need to come back for your second dose after 4 weeks. You can extend it between 6 and 8 weeks. It's going to be as effective. Every day we get people, in many cases senior citizens, ask us, what is the efficacy of the drug that we know of Covaxin or Covishield after the first dose, until such time as you have to take your second dose, which in the case of Covaxin is 4 weeks, nothing changes. But let's talk about Covishield. Suppose somebody takes it after 6 weeks, their second dose. What do we know about the effectiveness for that 6 weeks?
So there is data available for this, Vishnu, in public domain, and the Lancet published a paper that single dose is effective in 76% of cases. So there is 76% efficacy. Delaying the dose is a very good public health strategy when there is a fast spread, so that we can cover a larger population and get a better efficacy. So if you vaccinate somebody within a span of 4 weeks for Covishield, the efficacy is likely to be 65% to 68%. If you delay that by 8 weeks and 12 weeks, the immunogenicity goes up to around 75% to 85%. So obviously the delay, which the government of India has mindfully done, will actually allow us to have more people vaccinated in the vulnerable groups and the eligible groups quicker and faster, and also boost the immunity better. So there is no challenge at all. But remember one thing about vaccination. Vaccination will prevent deaths and severe disease.
Right.
It will not allow our hospital infrastructure, but may not prevent infection. So you may still get an infection which is asymptomatic or mild. That's something which we need to be mindful. For Covaxin, 81% is their efficacy after 2 doses.
Dr. Garg, there were reports that Covaxin was perhaps more effective in dealing with mutant strains. Is that something that you're also looking at more closely as we roll out more Covaxin, hopefully with more data coming to us?
You see, basically, whatever efficacy we have, we are working at 60% efficacy, and if we work at 60% efficacy, that's going to be good for Indian situation. Because you see, what we have to remember is that with this kind of efficacy and some infections, we are going to, attain our herd immunity. That is important. But efficacy of 80% is quite very good, and also for Covishield, which has been revised to 72%, that's a good efficacy. So as you were asking last time also, because this was effective against UK strains also, where we started getting the data on the mutant strains, and we were also giving them Covishield vaccine. So people who got the Covishield vaccine, they were, they either suffered from only, asymptomatic infections, or they did not suffer from infection. So that's how, because UK was the one which brought out this genome sequencing first, to talk about the mutant strains, but then they were simultaneously giving Covishield also. So it was seen less, the infection was seen less in those individuals who had got the vaccine. First of all, they were protected or asymptomatic.
Dr. Deshmukh, is it true that the UK strain had a single mutant? Over here, we are dealing with a double mutant?
Yeah, definitely that we are dealing with a double mutant here in India right now. Whatever the Covaxin or Covishield vaccine is to be given, I think it's going to be effective with this double mutant. Though a long-term trial or maybe this extended study itself is going to throw more light on the efficacy on this double mutant strain by the vaccination program.
All right. And where do we stand, Dr. Joshi, as far as some of the newer vaccines which are coming on, whether it's Sputnik or Novavax, that's also entering the trial process now. And the reason I ask this is because if we open up, and it's likely that everybody, adults, will get more of Covishield and Covaxin in the next few days, next few weeks, or perhaps even the next month or so when they open it up further. What about all of the other drugs which come online later on? Would people be able to perhaps get that to boost their immunity even further? Or why would those drugs even be relevant in our market if the large number have been already, given the jab?
No, Vishnu, we clearly need more vaccines. And clearly the current numbers which Covishield and Covaxin can produce cannot cover India at all, even in the eligible population. So clearly we are having 4 vaccines right on the anvil. The phase 3 trial of Zydus, which should be available by May, is almost nearing completion. That's a DNA virus vaccine. It's an Indian equivalent of an mRNA vaccine. It's a made in India vaccine by Zydus Cadila with Department of Biotechnology, a close collaboration like Covaxin. It needs 3 doses, very efficient, and probably the phase 2 data is very exciting. Phase 3 data is awaited. The next vaccine on this thing is the Sputnik vaccine with Dr. Reddy's lab. The data is ready. It is awaiting submission to the subject expert committee of the Drug Control Journal of India. So these 2 vaccines in the next 2 to 4 weeks will definitely see the light of the day. So we'll have 4 vaccines at least in the market, at least for a larger use. Beyond that, we are having 2 more vaccines which are undergoing trials in phase 1, phase 2 trials. One of them is Novavax, which you said. Second one is Johnson & Johnson, about to start their trials within India, single shot vaccine.
All right.
Beyond these 2, we are also having an mRNA vaccine made from Genovia within India, made in Pune, Make in India again, which is undergoing phase 1 trials, and a nasal vaccine from Bharat Biotech, which is also being produced. So I think we need more vaccines for sure. All vaccines, as Madam Garg very rightfully said, work. they need 60% efficacy. Most of them will have 80 to 90% efficacy.
So it's all welcome news.
Can't cover 139 crore.
All right, I need to wrap this up over here. It's just wonderful talking to all of you, and we'll keep doing that over the next couple of days. Well, joining us now, a very special guest, Dr. Zasa, the Myanmar Special Envoy to the United Nations. Thank you, sir, very much for being with us. Are you satisfied with the efforts made thus far by India in dealing with the situation? It has come up in the United Nations General Assembly a couple of times, but would you like to see New Delhi do more?
I think as the largest democracy country in the world, India must show its leadership in this Myanmar crisis. India should not betray Myanmar people. 54 million people of Myanmar are waiting the leadership of India in this very critical time. We know that India is going to be the president of UN Security Council for next month, and India has the power to stop the bloody coup in Myanmar.
Dr. Zasa, what would you like India to do to stop the bloodshed?
Number one, they must stop all kind of cooperations with the bloody, brutal military generals who are guilty of war crimes. These military generals are guilty of atrocities and crimes against humanity and ethnic cleansings. And we saw yesterday in Armed Force Day, India was also one of the countries that attended that bloody parades of military weapons. And India must stop now selling the military weapons to the military generals in Myanmar.
So, Dr. Zasa, that
kills its
sure.
own.
Sure. Dr. Zasa, that actually does bring me to my next issue. There are reports that India's defense attaché was there at that military parade. I understand the context of what you're saying. But the counter perspective over here is that India has had great support from the generals in Myanmar to fight insurgency on our own eastern frontiers. It's happened over and over again for so many years. It's worked extremely well for India. Therefore, for India to look away from the generals would perhaps affect India's security interests. So that's the counter perspective here. How would you respond to that?
I think stable Myanmar is also good for India. And then, I mean, all those insurgencies, once Myanmar gets democracy and the freedom, all those kind of crimes in our soil will go away. So they have to make the choice to be with these hateful military generals of Myanmar or to be with 54 million people of Myanmar. So that is the choice to make it. If they let us down now, not helping us to build democracy, it is a win-win for India and for Myanmar. For Myanmar becoming democracy is a win for India. For Myanmar becoming the country thriving economically, stability is a win for India. So you have to have civilian leadership that is disciplined. That is with international law. That is with human rights, justice and freedom. Once you get that, all our border will be peaceful. Everything India will benefit. That also, we know that there's a look-is policy. It is a look-at policy now. So if India want to see look-at policy work out, they must stand with the people of Myanmar until we get democracy and the freedom.
Dr. Zasa, very strong words. One final question to you. I look at you, a diplomat in another country, fighting for freedom in your land. You come and you speak to us so openly. You must be worried about your own family members.
It's very much so. As I speak for the people of Myanmar who are being oppressed and brutally repressed and killed. Now, of course, these military generals have charged me with high treasons against the country. And I have not killed anyone. I have not done anything, war crimes or crime against humanity. These same generals are the one who is committing crime against humanity, high treasons every day. Of course, I'm worried about my life. Of course, I'm worried about my safety. But my safety is not compromised with democracy movement. That is peaceful, that is non-violence. We learned a lot of non-violence from Mahatma Gandhi. He is the founder of non-violence policy. This time we needed non-violence policy to work out for the people of Myanmar. It has worked out for India. It must also work out for Myanmar. We need the people of India to support our peaceful movement and our non-violence movement against this one of the most brutal military regime in the world.
Dr. Zasab, this is a conversation we'll keep having because we completely understand where you're coming from, and hopefully you will be back in your country if it's as soon as it's peaceful, and that this humanitarian nightmare in Myanmar will be resolved with the support of India, perhaps in a more proactive way than what we've seen thus far. Dr. Zasa, thank you very much for speaking to us. Myanmar's special envoy to the United Nations over there, speaking about the crisis in his country, yesterday being the bloodiest day, hundreds having been killed by the military junta.